My name's Craig, I'm a doctor working in England, and I'd like to talk to you today about erectile dysfunction, or impotence as it's most commonly known. And I'd also especially like to talk about its link with diabetes. I'd first like to go through the who, what, where, when and how, followed by the diagnosis and then some treatment options. Okay, what? Erectile dysfunction is the inability to achieve or maintain an erection. It's fairly simple. I'm sure you already knew that. Okay, who? A big study in the 1990s showed that 40% of men over 40 got at least one episode of erectile dysfunction, some more, in their lifetime. If you are diabetic, you are 3 times more likely to get erectile dysfunction, and when you do, it's going to be 15 years earlier than if you're not diabetic, which is why there's a big thing between erections and diabetes. So why diabetes? Well, diabetes has lots of complications. First, there's macrovascular and microvascular complications, which is disease of the big and small vessels of the whole body, but also penis as well. So if you have disease of these small vessels and large vessels, you have difficulty getting blood flow to maintain or to get an erection. There's also nerve damage associated with diabetes, which it's the nerves that trigger erections and the relaxation of these vessels, and also sensation is a big part as well. There's also drugs. We're all familiar of the effect of alcohol on performance. Well, there are certain drugs that do this as well, and the biggest culprits are drugs associated with the treatment of heart disease and hypertension. And again, you guessed it, diabetes is another cause of increased risk of cardiovascular disease and hypertension. There's also psychological factors, of course. Diabetes and any chronic diseases increases your chance of being unhappy with your life and being more depressed, as you would expect. Low testosterone is also a factor that has been proven more recently in erectile dysfunction, and there is a link through something called metabolic syndrome of low testosterone and diabetes. So when do you feel you should talk to your GP about erectile dysfunction, or even if you are not diabetic yourself? Well, if you do have diabetes, you should feel free to talk to your GP about erectile dysfunction during your normal clinic appointments, because this can give your GP a good rough idea of your background disease. And if you're not diabetic, as I've said, it can be a symptom of diabetes, so can highlight the risk of cardiovascular disease or diabetes of yourself when you're having erectile dysfunction. And a GP should be all too happy to discuss these factors with you as part of your health check or your well-man health check to go forward. The diagnosis. The diagnosis of erectile dysfunction is usually by yourself. You tend to know the symptoms yourself. You then go to your GP and complain of these problems. We can do simple blood tests, we'll do blood pressure checks, all looking at your cardiovascular risk and your diabetes risk, and something as simple as waist circumference to check this. Okay. Treatment options. It's a sad fact that about only 10% of men seek treatment for erectile dysfunction. There's lots of treatments available. Firstly, health and lifestyle measurements, controlling blood sugars, keeping down the weight, stopping from smoking, things like that. There's then next pharmaceutical measures. There's certain tablets on the market which I'm sure everybody's heard of, which can be used. There's also injectable versions which you inject straight into your penis, and there's things like devices which use pumps and rubber bands to maintain erections, and gold standard towards the end of the scale is surgery to have implants to help you get erections. Okay, So I've covered a lot of things. The things I've told you is what is erectile dysfunction and how common it is, and for my personal slant, how closely linked it is to diabetes and how you should be checked for that. The risks are related to it, what can cause it, and how we diagnose it, and also how we treat it. But most important take-home message is that you need to tell us doctors about it in order to treat. And if we can do that, then we can find out if there's any underlying cause to try and sort out for you. Thank you.